Okay, so I've already washed my hands and now I'm going to sanitize them. Good evening, Miss Mitz. My name is Shaquan Mitch. I'm going to be a provider for today, and today I'm going to be conducting a musculoskeletal examination on you. Will that be okay? That'll be okay. Okay, so to begin my exam, I'm going to be taking a look at a general look of the joints. I'm going to be looking for any swelling, any irregular shape, any misalignment of the joints, checking for symmetry to make sure that they are even on both sides. And as I go through the exam, I'm also going to be feeling the joints for crepitus, things like cracking, any grinding of the joints, any and just any sensitivity to certain movements also. So first I'm going to begin with range of motion of the neck. Ms. Mitz, I want to get you to first extend your neck back. Okay, straight forward. And then I'm going to get you to flex your neck forward. Okay. And now I'm going to get you to bend your neck to the right. Can you go back forward? I want you to bend your neck. What I want you to do is a lateral bend of the neck to bring your neck to, there you go. Okay. Now to the left. Okay. And now I want you to rotate your neck to the right. Rotate your neck to the right. This way. Okay, now rotate your neck to the left. Okay. And now we're going to take a look at the shoulders. Okay, we're going to start with flexion of the shoulder. And I want you to flex your shoulder forward this way. No, I want you to flex your shoulder forward this way. Okay. Now the left shoulder. Okay, can I get you to turn this way? And I want you to extend both of your shoulders back like this. Okay. Okay. So did you feel any pain with any of those movements in the shoulders or the neck? No. Okay. Now I'm going to get you to abduct your shoulder. We're going to take it up as far as you can. Now I'm going to get you to adduct back down. Okay. And now we'll do the same with the left. And back down. Okay. Next part of the exam will be the elbows. First, I'm going to get you to flex your elbows. And I'll extend. And now I want you to hold your arms this way. We're going to do pronation of the forearms, then supination of the forearms. Okay. So now we're going to do some range of motion with the wrist. Okay. And first, I will demonstrate radial flexion. And now ulnar flexion. And I'll do the same for this hand. Okay. And so now I'm going to be assessing the MCP, the PIP, and DIP joints. So how I'll demonstrate that is, you want to stabilize your hand. And I want you to move your finger up and down. Okay. Now I'm going to stabilize this joint. And I want you to do it again. Okay, that was the PIP. And now I want you to do it again. Okay, and that was the DIP. Okay, now I'm going to be assessing both wrists. And with that, I'll also be testing for Teno's and failing sign. And those are two tests that will test for that can assist in diagnosing carpal tunnel syndrome. Okay. So first, I'm going to get you to flex your wrist up, now down. Okay. For Teno sign, what I'm going to do is tap on the median nerve here. Do you feel any numbness, pain, or tingling with that? No. Okay. And for failing sign, I want you to compress your hands like this. And we will do this for approximately 1 minute. Do you feel any tingling, numbness, or pain with this movement? No. Okay. For time purposes of the video, we will not do the full minute, but you would do that for a full minute with an actual patient. Okay. Okay, next we're going to assess the hips and the knee joints. So first, I'm going to start with flexion of the left and right hip. So what you'll do is you'll take your leg and go this. Okay. Okay. And now for the left hip. Okay. You turn around this way. Okay. I want you to extend your right leg back. Okay. And now the left leg. Okay. Turn this way. And now we're going to do abduction of the hip. We'll go through this. Okay. And now the left. Okay. And now we'll look at the range of motion in both knees. So I will stabilize you here and we will extend the knee. Now, yes, down flex. Okay, we'll do the same for the left side. Okay. Okay, to further assess the knee joint, I'm going to adduct. What I will do is I will just apply pressure here and push the knee joint outward. And then to adduct, I will apply pressure and push it inward. Okay. Okay. Did you feel any pain or discomfort with any of those movements? No. Okay. Okay, the next part of the exam, I'm going to be assessing the spine. Okay, can you turn this way for me? And when I'm looking here, I'm checking for things such as scoliosis. I'm going to be looking at the alignment of the shoulders, making sure that one side is not higher than the other. They're both at the same height. The hips are also at the same height. So what I would do is I would get my volunteer to bend forward here. And as she do that, I would be also checking for the height of the rib cages to make sure one side is not higher than the other, and also taking a look at her spine for any curvatures. And so next, I have my patient now laying supine. And what I'm going to do now is a straight leg raise. And when I raise the leg, if there's any pain between 35 to 70 degrees, that could be a problem coming from the lumbar spine. Any pain with that? No. Okay. So the last part of my examination, I'm going to be assessing the ankle joints. So for that, what I'm going to do first is I'm going to invert the ankle joint, which I would take it this way. I would invert it in like this. And the exversion of the joint would be this way. And then I would do the same with this side. Any pain or discomfort with those movements? No. And now I'm going to do flexion and extension of the ankles. Flexion and extension. Okay. Then you may sit up now. And while assessing all of her joints, I did not feel any crepitus. There was no cracking. There was no grinding of abnormal grinding of any of the bones or the joints. She did not report any pain, any numbness. I did not feel any inflammation. All of her bones in her joints are aligned. And that would conclude my exam.